Meet Mark. Mark was cycling along the roads of Manhattan until Mark's accident causes him to be admitted into an emergency room where he receives great care and is treated for all of his injuries. Hopefully, he's able to be discharged the same day. The nurse, physician specialist, and clinical analyst that attend to the patient during their visit document a very elaborate and clinically accurate patient chart inside an electronic medical record system. And after the documentation is complete, it is sent for medical coding. So, what is medical coding? It's the first step before billing workflow hits the billing department. When a patient receives health care, the provider documents accurately the care provided. The medical coder will then abstract the information, assign the appropriate codes, and set the stage for creating the medical insurance claim to be paid. Medical claims get submitted to public and private payers where they get approved, delayed, or denied. If delayed or denied, it disrupts provider cash flow. ICD-9 medical codes are currently used for diagnosis codes. The coding process is heavily manual and error-prone, which results in numerous problems, two of which are denials and delays. Now, as mandated by the Obama government, providers have to comply with ICD-10, the new version, by October 1, 2015. The new version is bound to create chaos as codes are almost 10 times more complex, moving from 15,000 plus codes from ICD-9 to 150,000 in ICD-10. Hospitals and physician groups are going to see big jumps in the problems that were already incumbent with ICD-9, like claim denials, accounts receivables, and productivity losses, thus disrupting their bottom line. Temporary productivity loss could be up to 50% for the next 3 years, whilst permanent productivity loss after ICD-10, given the code complexity, stands at 10%. Between 2001 and 2004, Canada in 9 provinces progressively implemented ICD-10. A comparison of information classified by ICD-9 and ICD-10 was undertaken. A near 50% productivity loss was recorded, and that was just for upgrading to 17,000 ICD-10 codes. The US version will contain 120,000 plus codes and makes the coding process more complex, slower, and error-prone. Centers for Medicaid and Medicare Services, CMS, estimates a 200% jump in medical claim denials and 20 to 40% jump from already existing accounts receivables of 6 to 8 weeks, which would hit provider bottom lines. American Medical Association-sponsored research estimates the following net loss in productivity losses, denials, and delays per year in post-ICD-10 world. Small practices losing up to $120,599. Medium practices losing up to $501,147. Large practices losing up to $5,011,463. So, how do we solve this problem? The solution is a one-click code, an enhanced computer-assisted coding technology which uses cutting-edge machine learning algorithms which automatically learns to code accurately. It's a HIPAA-secure cloud-based SaaS software and could potentially be deployed in less than a day. We call the machine learning-based coding platform iBuddy. In a nutshell, iBuddy reads the charts like a human would and extracts the medical context in machine speed. For the first 8 months, iBuddy does not code, but learns from the medical coder's manual process. And more, it also intelligently learns about the denials or delays which were caused in those 8 months to make iBuddy smarter over time and learns from provider historical mistakes. After 8 months, the coding manager can in one simple flip from manual to ECAG mode make the product automatically start coding the patient charts on the fly. From then, all the coder has to do is review the codes, a productivity bump of near 100% instantly. iBuddy does all the magic. Finally, iBuddy maximizes provider revenue thanks to our unique patent-pending feature called IntelliShare, where the coding intelligence from all similar provider profiles are applied in the cloud to improve coding accuracy instantly. The one-click code product will help boost your cash flow, stabilize your workforce, and make life easier in an ICD-10 world. One-click code. Denials recaptured.